Good morning. Good morning. How are you? How are you doing? You see me, you see good vibes, you see happiness, you see good energy. How are you feeling? Thank you so much for tuning in. Thank you so much for joining us. As per usual, this is your favorite show and your favorite host, K is Constant, your favorite host. I go by the name Nina GIKUNDA, and this is Woman Crush Wednesday, Rise Today. Thank you for keeping it KUTV. As I usually say, thank you for rising today and joining us. Omekuaje, how has your week been? How are you feeling? Are you healthy? Are you okay? Why are you up this early, going to school, taking your kids to school? Do you have a morning run, a school run, rushing to work? Why are you early this morning? I'm early because I'm here for you. I have to be here. Otherwise, thank you so much for joining us. If you're just joining us, I am your host, Nina GIKUNDA, and this is a Woman Crush Wednesday, Rise Today. It's a beautiful day to be happy, a beautiful day to spread positive energy and positive vibes, a beautiful day to start over, a beautiful day to make your life better. Karibu sana. You can join us on all our social media platforms at KUTV Kenya on Facebook, KUTV_Kenya on Twitter, and at KUTV Kenya on Instagram. You see me, you see good conversation, you see educative conversation, you see entertainment, you see interaction, where this is where you are allowed to share your opinion as it is. Unfiltered. Let us know what you think. Today we get to talk about self-care in regards to sexual reproductive health. How does self-care make the situation better? How does self-care enable us to curb some diseases? How does self-care enable us to make our health better? How does self-care make you live a healthier life? We will be especially in regards to sexual reproductive health. We'll be having that conversation at some point in through today's show, so stay tuned. Also, let us know as an individual, how do you take care of your sexual reproductive health? What do you do? Do you eat well? Do you use any kind of medication? Do you watch your diet, water? What do you do to take care of yourself if you actually do? And if you don't, send in your questions on how to do it, what to do. You can send in your question as it is in your mind right now as we are starting. We'll be having that conversation later on. We also have a Vera Beauty College. They're here to share with us the services they offer, what they do, the classes, everything. Vera Beauty College. You hear Vera Beauty College, you hear a very big name. It's a name that has been in the industry for quite a number of years in regards to, offering services, offering education in regards to hair and beauty. So stay tuned, and we also have an artist who will be joining us today to share with us her musical journey. And as per usual, you see us, you see good things, you see us, you see proper vibes. We have Zala. She's a Kenyan Ugandan artist. She will be coming to share with us her music, her new music, everything in regards to Zala. So as per usual, send in your questions, send in your opinions, and also tell us how you've been. How are you? How are you mentally? How are you? How is your health generally? Talk to us. Our social media platforms are at KUTV Kenya on Facebook, at KUTV Kenya on Instagram, and KUTV_Kenya on Twitter. We will also be celebrating our Woman Crush Wednesday for today, because what is Woman Crush Wednesday if we're not celebrating a woman doing a tremendous job out there? So stay tuned. I'll not tell you who we're celebrating today. Stay tuned to see who and why we will be celebrating her today. So right before we get into all that, we will be coming back to you with the traffic updates. Karibuni sana. We get our traffic updates from Matthew on Twitter. So at Mathroute, MA number 3 ROUTE, if you would like to send in some updates, or if you would like to read the updates to update yourself as you're getting into the roads to wherever you're headed to this morning, to work, to school, to run your errands, whatever it is, get your updates from there. The cop at Jamhuri Junction does a very good job in controlling traffic. Give credit where it's due. We get to see a lot of negative vibes in regards to cops on the road. So, I mean, that's good to see this early morning. The commuter train from Ruru is currently at the Mutindwa stage. So if you use the commuter train to go about your errands for the morning, rush before it leaves. That was roughly about 15 minutes ago. I think it should be there still. So you still have, or you've been left. So, oopsie, next time. A broken down trailer on the southern bypass as you approach Kikuyu. So that's roughly Kikuyu all the way to Waiyaki Way. So there's traffic on that end. Mombasa Road from Syokimau to Cabanas, the road has got pebbles. Drive carefully. So there is loose stones on the road. Be a careful driver. Traffic moving very slowly from Survey towards Muthaiga on the highway. So if you are on Thika Road approaching Survey all the way to Muthaiga, there is traffic and it's moving slowly. Thika Road, we need an expressway. This traffic is too much. Really? Where would you put it? Where would you put an expressway if you'd have it on Thika Road? That math is not mathing. If you think Thika Road needs an express, and where would it be going? Where would it be going if you would be having an expressway on Thika Road? Anyway, Thika Road jam starts at KCA University. So still on Thika Road, KCA University, there is a lot of traffic. I think that's it for traffic updates this morning. Imagine an expressway on Thika Road. What a wow. We've come to the end of our traffic updates. We will be coming back with the news updates. Welcome back. As per usual, I'll always say thank you. Thank you for joining us. I am Nina GIKUNDA. If you're just joining us, Atujenda Sana. We've just done our news, our traffic updates, and a little bit of what we will be having today, which I'll talk about more right now. Today we get to talk about sexual reproductive health. How do you apply self-care in regards to your sexual reproductive health? What benefits does self-care have to you as an individual to prevent you from having issues with your sexual reproductive health? I'll give you an instance. Part of self-care includes taking care of whomever you share your body with. If you share your body with many people, you are at a higher risk of getting diseases, which is not proper care to yourself and your body. We've always spoken about ABC. A is abstinence, B is be faithful. If you can't abstain and if you can't be faithful, you can make sure to use contraception, and most importantly, the C stands for condoms. So if you cannot apply A and B, make sure to apply C. Now that is self-care. That is you taking care of your body. That is you ensuring that you're careful about who you're sharing your body with. The other person, you don't know what the other person is carrying, you know. And I'll reflect on we women. There's a lesson I previously learned as I was reading an article somewhere, that was saying men are carriers of herpes. Yeah, I'm sure we all know that. And herpes ends up being cervical cancer to women. So imagine if you are a woman and you have many partners. you get herpes and you don't know that, and then eventually you get cervical cancer. You did not take care of yourself when you had a chance to. I'm not saying that the people who have it did not take care of themselves. You never know where it came from. But as a prevention, self-care, take care of yourself and who you allow yourself to share your body with. Number 2, things like cleanliness, things like hygiene, things like what you put into your body. What do you eat? What do you drink? The kind of contraception you use. Last week we had the conversation on contraception, and one of the guests told us something that we all know, the use of emergency pills. We've been taught that that is used a maximum 3 times in a year, and that is if you really have to. If you really, really have to. So if you overconsume emergency pills, you tamper with your body, you tamper with how your body works, especially your reproductive body parts. You tamper with everything, and then in the future suddenly you can't conceive, or suddenly you've acquired a disease, or suddenly you've acquired things that you should not have acquired. Part of self-care is going to see a doctor to confirm, what can I use as a contraceptive? How do I take care of myself? How do I prevent pregnancy? How do I prevent STIs? How do I prevent STDs? So this and more is what we are going to talk about in the forthcoming conversation with our guests today. Send in your questions, send in your opinions. Let us know how well it is you take care of yourself and what it is you do to take care of your health, especially your sexual reproductive health, both the men and the women. We will be coming back to you shortly with our news updates. Welcome back and into our news updates for today. Interior and National Administration Cabinet Secretary nominee Kithure Kindiki says his priority areas will include ridding the country of criminals, bandits, terrorists, and cattle rustlers. Usually a soft-spoken politician, Kindiki, who opened yesterday's vetting sessions, sounded tough on security matters, perhaps giving the clearest indication of his style if he succeeds Fred Matiang'i.
Professor Kithure Kindiki will come face to face with and tackle security matters of significant magnitude should the vetting panel at the 13th Parliament approve of him to start serving the people of Kenya under the Ministry of Interior. To start with, Kindiki will have to craft a working solution to the rampant bandit attacks and stock theft in the Rift, which has claimed lives of innocent Kenyans. To this end, Kindiki advocates for, among other things, a heightened community policing.
99% of our people are law-abiding. The 1% that are lawbreakers will be extremely ruthless with them, and we will speak very little about or with them, and will act decisively, ruthlessly to ensure our nation is secure.
Just yesterday, when I was undertaking this very important national duty, I received a text that criminals from my neighboring constituency, that is Tiati, ambushed herders, injured one person, and drove away with cattle. As if that was not enough, the criminals continue to be bolder by the day. This morning, they attacked again. As we speak, they have killed one person.
On Kenya's territorial integrity, the Migingo Island is still being claimed by both Kenya and Uganda, leading to arbitrary arrest of Kenyan fishermen by Ugandan police. Kenya is also having a tiff with Somalia over an oil reserve in the Indian Ocean, a matter that was escalated to the International Criminal Court, but which remains a major security concern. Expansion of the wellness and counseling units to tackle mental health in the forces was also floated.
I intend to equip, expand, and fully capitalize the wellness and counseling unit, which I intend to link with the soon-to-be established Kenya Police Hospital, the Kenya Police Service Hospital, and the Kenya Prison Service Hospital.
And on crime, the nominee intends to use the necessary force while observing human rights principles.
A case has been made that violence is not an option, and I agree. But it's one of the options. It's one of the options. It's not the only option, but it's the one of the options. Because what language are you going, what discussion are you going with a criminal who has stolen 100 cows from an innocent person and is hiding in a gorge? What is he doing in a gorge in the first place?
Kindiki promised not to engage any political interest should he find favor in the eyes of the vetting panel, and confirmed that his relationship with the Deputy President Rigathi Gachagua remains intact despite the two of them wrestling it out to deputize President William Ruto, a duel which he lost. The Interior nominee was scheduled to take only an hour before the Moses Wetangula-led panel, but ended up taking an extra hour, perhaps signifying the premium placed on the ministry. Dennis Omondi, KUTV.
Moving on, former Central Bank of Kenya CBK Governor Professor Njuguna Ndung'u has yesterday also appeared before the vetting committee. This comes after his nomination as Cabinet Secretary for Treasury by President William Ruto. Ndung'u being faced with tough questions concerning his plans for the revival of the ailing economy.
I swear to testify.
Second on the chopping board was Professor Njuguna Ndung'u, who served as the Central Bank of Kenya governor for 8 years, between the year 2007 to 2015, and after his life and career background, Professor Njuguna was faced with hard questions which made him break a sweat. Fiscal interventions on the course the nation should take to handle the debt crisis issue and make sure the cost of essential goods is kept under control were brought up. Professor Ndung'u stating that his vision, if approved, is to protect private investment, to develop and regulate markets, and to mobilize domestic resources to improve the country's revenue base.
950.
The issue of how many banks collapsed under his tenure as governor of the Central Bank of Kenya was not left behind.
During my time, there is no bank that collapsed. I was governor of the Central Bank of Kenya from March 2007 to the beginning of March in 2015. There were several mergers, but those mergers were actually geared towards preventing any collapse of the banks, because market situations do change. Some projections in marketplace can change, and so the regulator must know what to do.
Ndung'u was later asked to clarify his mention in the Grand Regency Hotel scandal, reportedly worth 2.9 billion shillings, the controversy involved in the hotel sale, the secrecy under which it was negotiated, and the identity of the buyers.
The case of Grand Regency, I think the statement is that I was adversely mentioned. I was an agent of government, and this was a government-to-government sale, and I was the one to negotiate and to receive the payment, which was actually received by the government. The whole issue was, how was it appropriately done? According to that commission, it valued the hotel at 1.8 billion. Then the question they were asked, what about the central bank? How did it value the hotel? It was at 2.2 billion. And then how much was the hotel sold by the central bank? It was sold at 2.8 billion.
About the entire issue of Imperial Bank paying for his wife's trip to Thailand, Ndung'u said that he paid an agent at the resort directly for that trip.
I've been a victim of abuse of the criminal justice system. For example, the procurement that has been mentioned. The whole idea was to get Njuguna Ndung'u out of the central bank. How do you do it? That's why even if you go to the records, you will just be embarrassed, the kind of facts.
If approved, Professor Ndung'u will succeed outgoing Finance Minister Ukur Yatani. Eugene Mayabi, KUTV.
The Aisha Jumwa murder case has taken a fresh turn as the deceased victim's family requested that Jumwa's murder charges be withdrawn in a written affidavit, since the family wants to solve the matter out of court after they sent a letter to the court requesting to drop the charges.
The family of Wanjola Ngumbao in Malindi's Ganda ward, who was killed in a confrontation with Public Service Cabinet Secretary nominee Aisha Jumwa, has applied to drop the murder case against the politician. Jumwa was charged alongside her bodyguard Geoffrey Okuto in 2020 over the murder of Michael Ngumbao Jola. The decision to withdraw charges against the former Malindi MP was communicated to a Mombasa court on Tuesday. This comes a week after the Director of Public Prosecutions withdrew graft charges it leveled against the CS nominee, who was accused of irregularly obtaining 19 million Kenya shillings. In 2019, Mr. Ngumbao passed away in a Malindi hospital after being wounded in the shoulder during the Ganda ward by-election campaigning. During the proceedings of the cases in March and April, it became clear that vital evidence had not been given to the defense team, therefore a key witness in the murder trial against former Malindi MP Aisha Jumwa was prevented from continuing with her testimony. On Tuesday, October 18th, the family requested to settle the matter out of court, arguing that the lawmaker was not a principal offender in the case and preferred she presented herself as a witness instead. The prosecution may choose to grant the request and drop the charges against the former Malindi MP, or direct that the matter heads full hearing on grounds of national interest. Jumwa had appeared before the National Assembly's Committee on Appointments chaired by the Speaker of the House, Moses Wetangula, where, if approved, she will join a cluster of coastal leaders appointed to serve in cabinet under President Ruto's Kenya Kwanza administration. Susan Wayaki for KUTV.
Nairobi West Hospital has put a Kenyan on the international map after performing the first bone marrow transplant treatment in the country. This is expected to bring relief to many Kenyans who travel abroad to seek medical treatment.
Nairobi West Hospital will go down in annals of history as the first ever hospital in the country to offer bone marrow transplant treatment. This milestone achievement means Kenyans with blood disorders will no longer be required to travel out of the country for bone marrow transplant.
I would be happy to announce at this particular moment that we have transplanted our first patient with bone marrow. So the whole idea behind bone marrow transplant is to actually take out or obliterate all the abnormal cells and replace them with normal functioning cells.
The first to undergo treatment was a 55-year-old patient who was diagnosed with multiple myeloma on October 10th and is expected to be discharged from the facility in the coming days.
And she is doing extremely well, probably to be released in the hospital in the next 1 to 2 days.
But the treatment will not come at a cheaper price. It will cost patients between 2.5 million to 3.5 million shillings, according to Andrew Kanyi Gachi, Chief Medical Director at the hospital. The said price is cheaper than the cost incurred when seeking treatment outside the country.
That's one of the things we are considering, because we have been saying that these people have been traveling to India or to other countries, of course at a substantial cost, and of course it's a kind of loss to a foreign exchange or exchequer.
With the latest breakthrough and health services closer to home, bone marrow transplant patients seeking medical attention abroad can now rest at ease. Auma Evans for KUTV, Nairobi.
In matters housing, President William Ruto yesterday officially opened the affordable housing project in Ongata Rongai, Kajiado County. The event was attended by various leaders, including Kajiado Governor Joseph Olelenku and the Minister for Transport, Infrastructure, Housing and Urban Development, James Macharia.
President William Ruto earlier today led the opening of affordable housing project in Ongata Rongai, Kajiado County. This being his first tour to the region since his swearing in as Kenya's 5th president. The president used the opportunity to applaud King's Company, which does house building practices in urban centers, for cooperating with both the county and national governments in promoting the project. He requested various private companies to do the same.
Hata kama hii project ni private kati yao na wale walipatiana ardhi hii, serikali ya Kenya itasimama na wao kuwatafutia wale watakaoishi katika hizi manyumba.
On the other hand, President Ruto has promised that the government is going to invest on the project in ensuring 200,000 houses are constructed yearly in all of the 47 counties.
Excellency, you made sure that as you support developers, you have not left the people, the consumers, who you take over those housing units.
In his address, Dr. Ruto noted that Kenyans with small businesses will also benefit from the launch of Hustler Fund that has been slated for December this year. The funds will be accompanied with lower interest to enable Kenyans to repay on time.
Tarehe 1 Disemba tunaanzisha Hustler Fund ambayo itahakikisha kila Mkenya anapata mkopo kwa riba ya chini.
With the issue of improper sewerage systems which has greatly affected the residents of Kajiado County, the president has therefore given a directive that the concerned authorities to liaise with the county government of Kajiado in finding a solution to the matter. Other leaders who attended the event include Kajiado Governor Joseph Olelenku and the Minister for Transport, Infrastructure, Housing and Urban Development James Macharia. Shadrack Simiyu, KUTV.
Over 2,000 farmers in Ilmotiok Ward, Narok West Sub-County have received smart farming training courtesy of the Farm to Market Alliance, which is collaborating with the county government to increase farming in the region.
Narok's County Chief Officer in charge of Environment, Water and Sanitation, Obadia Rono, while on a smart farm training session with farmers in Narok County, has stated that one of the most important lessons residents of Narok have learned is how to prevent climate change and boost agricultural output via appropriate crop cultivation. While it was on a farmers' field day in the region, they were challenged to set up tree nurseries in each ward in order to increase the number of trees in the county.
Kuna kuwahimiza kupanda miti na kuchunga ile miti tayari wamepanda, na pia kuweza kuwahimiza wajue jinsi ya kufanya ukulima kwa ile njia ya kisasa.
According to the chief officer, the county will soon get 100 million shillings that donors have contributed to assist combat climate change, which will be dispersed evenly across the county's 30 wards. The Farm to Market Alliance spokesperson Anthony Nyongesa, on the other hand, noted that their major goal is to assist the county administration learn how to implement its programs in a way that benefits farmers.
Narok County imekuwa one of the counties ambayo itapata hiyo pesa. Tunatarajia kwa hii mwaka wa fedha kupata zaidi ya milioni 100.
The training would therefore help farmers in the management concept that focuses on providing the agricultural business with the infrastructure to use sophisticated technologies for tracking, monitoring, automating and analyzing activities. For KUTV, I am Teresia Maluki.
Welcome back. Thank you so much for staying with us up until this minute. We've just concluded our news updates. For subsequent bulletins, keep it KUTV. We have news in through the day, updates, breaking news, everything. You will find it right here. Just keep it KUTV. Everything will be offered to you in through the day. Earlier on, I mentioned that we are having conversations in regards to self-care. Self-care in sexual reproductive health. How do you take care of yourself? What do you do to make yourself healthier? What do you do to ensure that you're not putting yourself at risk in acquiring diseases? What do you eat? What do you do to your body? Who do you share your body with? This and more questions will be answered by our guests who are in studio with us. So stay tuned. We will be coming to you after this short break.
Kwanza tuende lunch. Chapo. Kama ndikimo.
Rasha piga shada kuna giza. Sikinai tujinai siweke story. Kata maji pia shada liko nasio nikosa msupo si stress. Kama rende kisha basi nipe. Najua ni
big up, Brother, ukiwa Adriva, big up, Sis, big up, Shows, Mamba, big up, Oya, wase wote, okay, my principal, big up. Anoni meokoka, whatever me say no, I know, I know, dansi meshika mashinani, kila choche kila mtaani, dansi naleta burudani. Naye akamwahidi Mwenyezi Mungu kwamba ikiwa mimi umenilaani, mimi umenifukuza, mimi umenitoa katika rehema yako, basi nitaenda katika hii dunia, lakini nami nihakikishe siingii motoni peke yangu, bali niwe na wafuasi. Lazima nitafute wafuasi, kwani huo moto nitakuwa nimeombewa mimi peke yangu. مولاي صل وسلم. So from your mind conceive, then you shall achieve it. No make them stop you with them. It's my master's will. I see the sun. Martin Luther Black, Malcolm X Black.
It is not casting a stone that you must have money. You must have that ambition and work on your ambition. Someone will recognize you along the way and support you. I can give an example of my governor in Kericho County. He was not a rich person and he wasn't elected as an hustler, but he's just had an idea that I want to be a governor, I have a plan for the people of Kericho County. But along the way, after talking to people, convincing people, many people came in and supported him. Same case for Toto. So what I can encourage young people, as a young person myself, do not let your dreams go.
To the Church O'Clock Show. I'm your host, Esther Becky.
And my name is DJ Terrell.
We start you off with a word of prayer and get you started with a live transformational worship experience. And have our minds renewed by the word of God on the word segment.
And not forgetting new music za hii wiki, yani ndakuwa bado nawapatia pale wasanii wamekuwa kiwakali. Mama bonde utukuke
So make sure manzo tune in because zitakuwa zina flow pia pale mixes kwa wingi, yani zitakuwa zina come through, and pia performance yani from our gospel artist hapa on Gospel Arts
from 7 to
10 a.m. only on KUTV.
Sasa ni bora zaidi, mwanzo mpya, mambo mapya. Msimu mwingine wa Boresha Kilimo unakuletea teknolojia ibuka, kilimo mseto, uongezaji thamani. Teknolojia dijitali ya mauzo inawezesha ufikiaji wa masoko. Soko moko yako, mahangaiko yako ya kufikia masoko yamefika kikomo, manake tunao Mkulima Yangu.
What Mkulima Yangu does is it connects farmers with the market.
Hii ni Boresha Kilimo kwa ushirikiano na Mkulima Yangu. Atafutaye hachoki na kichoka kesha pata. Kwa makala maalum ya kilimo, ungana nasi kila Jumamosi saa 6:30 kwenye kipindi ukipendacho Boresha Kilimo.
Access to knowledge, solution to unanswered questions.
Guidelines to pursuing your rights and repossessing your property, intellectual or material.
This and more only on Law Matters.
Maelfu na maelfu ya wahamiaji wakiwa na watoto kutoka nchi za Amerika ya Kati wanaendelea kuwasili kwenye mpaka kati ya Marekani na Mexico.
But folks, I'm going. Thank you very, very much. I appreciate it. Thank you.
Ni habari kutoka pembe zote duniani.
People pass vuguvugu. People pass ni idea.
Tazidi ananyonya, hanyonyi vizuri, anakuwa hayuko comfortable.
Jeshi la Jamhuri ya Kidemokrasia ya Kongo linapambana na waasi wa ADF.
Kwa sasa wanatoa wito kwa mashirika, makampuni na vile vituo vya uchukuzi.
Mambo mengi yatakwenda kama yalivyopangwa.
Hapa ni kuna mmoja wa viongozi wa chama cha wavuvi katika eneo hili.
Zaidi tunajaribu kuwapa chanjo ili ina boost ama inanyanyua kinga ya mwili, ndio inaenda kupelekea kupambana na virusi.
Ni duniani leo, Jumatatu mpaka Ijumaa, moja kwa moja kutoka VOA Swahili, Washington DC.
Welcome back. Thank you so much for joining us. As I had earlier stated, I have the Reproductive Health Network Kenya here to talk to us about self-care. Why is self-care important? And by self-care, if you're just joining us, is not self-care for your face, for your skin. No, your sexual reproductive health. How do you take good care of yourself? I had mentioned some little ways earlier, like who you share your body with, the things you consume, how clean you are, how often you see your doctor. These are some of the things that matter in regards to self-care. But it is not in my place to give you all this information. I am equally here to learn. So I have an amazing team with us. They're here to share with us everything in regards to self-care with your sexual and reproductive health. Allow me to introduce to you my amazing guests. Karibuni sana.
Thank you so much.
Thank you so much for joining us.
Thank you.
We really appreciate. Ladies first, right? So please introduce yourself.
Should I look at you? Should I look at them?
You can look at them.
My name is Pamela Diambo. I work with the Reproductive Health Network Kenya, and I am the advocacy officer there. And we are basically a network of healthcare providers offering evidence-based sexual reproductive services and information. So yeah, I am here as an advocate for self-care in sexual reproductive health. Yeah.
Wow, thank you. The blessed man amongst women.
Finally, my name is Tara K. Tara is a youth member of the Reproductive Health Network, the youth network specifically. Tara champions for sexual reproductive health and rights, specifically for adolescent girls and young women. So we are here to speak about self-care and how you can improve your access to reproductive health, both information and services. Thank you.
Pamela, why is self-care important? No, let's start with what is self-care?
What is self-care? Self-care is something it means different things to different people. And for us ladies, self-care could be a day at the spa, go make your nails, go for a massage. But when we come to health, I will give what the WHO defines it as. Self-care is basically the ability of individuals or families or communities to be able to promote their own health, to better manage their own health, to prevent diseases, and to even be able to cope with illnesses or disability with or without the help of a healthcare provider. So it can be you doing it alone, or you can do it with the support of a healthcare provider. So when we put it in the context of sexual reproductive health, this is basically you being able to know about your reproductive health. So I know my reproductive health. Have I gone to the doctor? Is it okay? If I have an illness, for instance, if I get a sexual transmitted infection or disease, am I able to cope with it? Am I able to treat it? How am I going to prevent myself from getting it? So that is what basically self-care means.
Why is it important?
Why is it important?
Let's allow Tara to give us that one.
Sure. As I introduced myself previously, I'm Tara, and it's a pleasure to be here. I believe self-care is important to youths because we have come along a decade of the pandemic. We had the COVID, and we had a lot of challenges in accessing self-care because of the restrictions by our beloved government. So I believe self-care is important because it ensures that we have attainable health services with or without a healthcare provider or a caregiver. So self-care entails, or it gives someone an autonomy to have your own healthcare without you really accessing a healthcare provider. Yes.
Pamela, what should people do, like I as an individual? What are some of the activities I can practice to ensure I am practicing safe self-care?
What we normally say in terms of health is a very delicate issue.
Yes.
So we cannot just tell you, go home, jitibu. You know, it's not as simple as that. We usually recommend that self-care be initiated at a health facility or with a healthcare provider. So the provider gives you the right information. So what do you need to know about this? So for instance, I go to a healthcare provider, I want to get information about contraceptives, for instance. I will have to go there, get the right information before I make informed decisions for myself. So there are so many things you might need to do to practice, like a very comprehensive self-care. First of all, get the right information. Like I've said, we start from the health facility. If you cannot go to the health facility, make sure you get a professional to just explain to you what this is in the context that you want to know. Also, you need to adhere to what the healthcare provider tells you, because you cannot just go start doing things on your own. You need to follow a certain procedure. If the provider gives you pills and tells you, hey, unameza mara mbili kwa siku, you cannot just go outside and start saying, I will do it once a day because I don't want to do it at night. So you have to get the right information, you have to follow procedures, you have to also be clean yourself, because when it comes to sexual reproductive health, I mean, you have to maintain sanitation, cleanliness, because I will say something that has been practiced for the longest time is, for instance, us girls, our menstrual health. People, that is self-care. People don't know that, but it is self-care. No one tells you to go to the shop to buy pads.
Yeah.
No one tells you that after 3 hours you're supposed to change pads. Even as much as you will read on it on the internet, but you'll just feel like, no, this is uncomfortable, I need to go
change. Yeah.
So you have to be very self-aware to know if things are going wrong, if things are going right, what do I need to do, who do I need to go to? Yeah.
Wow. Moving on, Tara, what are some of the gaps that exist in regards to access of good reproductive health care, especially for the young adults and adolescents out there?
I believe there are quite huge gaps that we need to address in terms of enhancing self-care among adolescent girls and to be specifically young women. The gaps range from information up to service access. So when you talk about in terms of information, this comes in an instance where we still have marginalized cases of youth. We still have ignorance among the youth in terms of accessing information. And we as champions for sexual reproductive health and rights, we have a mandate to ensure that our fellow youths and our fellow adolescent girls and young women get the right information. Just as Pamela has said, that we provide them with the correct information on how they can champion for their own self-care. What criteria are we using to ensure that self-care is available in the community? What gaps, or we have an aspect of digital health. Digital health is an advancement that is championing for self-care among adolescents who are thriving in the internet sector, because we tend to see that a lot of young people consume internet, and both of you can agree with me.
Yes.
So digital health is an advancement that we are using to cater for the gap of information. So in terms of services, we have different services that are coming up that tend to champion for self-care. But we have to equip our youths with the knowledge on how they can access these services and where to get them. Yep.
Earlier on, I had stated that part of self-care is, you've also stated it, contraceptives and seeing a doctor and all that. There is still some amount of stigma in regards to the approach of self-care in regards to sexual reproductive health. What can be done? How do we go about it?
I think even before we go to what can be done, there's a lot of challenges, barriers to accessing this information and services. I think I'll just build on what Tara has said.
Yeah.
In regards to young people, there's a lot of stigma. When you just go to a health facility and just mention, I want contraceptives, it's like it's a big deal. Yeah, you're having sex.
Especially if you find older people at the counter.
Yeah,
yes.
so it's such a big challenge. You're facing stigma, and that is why we are promoting self-care, because this will give you the privacy. You are able to sit at home, take your gadget, text the doctor, I am feeling this and this, I want this and this. I can be able to get services without necessarily going to the health facility. It will also, issue of cost. You know, as young people, most young people, we can't say that we are that well, have money.
We are not yet there.
We are not yet there. Yeah, some of the people are still dependent on their parents. So when you even look at the issue of cost, someone needs to get services, but they cannot even go and pay their own fare to go to a health facility to to get the information or the services they need. So when you look at the aspect of healthcare in terms of digital health, go through a hotline. Like for instance, us, we have a hotline called Nena na Binti. You can just call us and say, I think I need information on contraception. Which one is good for me? What do I do? Or just direct me to someone who can help me, who is around me. And then we refer you to someone who is very close to you, and you can go get information from there. And there's a lot that is coming up, even with key population. As you can see, people are becoming more open. The LGBTQ are coming up, and they face they face a lot of stigma. They face a lot of stigma when they are going to seek these services. Someone will say, for instance, someone was raped. There's a lot of corrective rape on gay people. Yeah. Sorry. There's a lot of...
I am equally shocked.
Yes, there's a lot of corrective rape that happens. And for instance, someone you know who is a lesbian goes to a healthcare facility, and you're like, you are gay. How are you even pregnant? You know, there's a lot of stigma that is facing. Yeah.
I'm sorry for laughing. I'm so sorry.
Yeah, so these things happen, and self-care is here to sort you. It's here to sort that young person who is forced to, who is forced to wait in line with someone who is their neighbor. You are here in line. We are saying we are going to see a family planning doctor, a contraceptive doctor, and you're with your neighbor, mother's friend. Issues of consent. You are going there. You want to tell the provider to give you a condom, but because they know your mother, they are like, mama yako anajua
uko hapa,
mama yako anajua uko hapa, wacha nimpigie simu.
Alafu kwa ni mama wa kanisa at that particular point.
So you see, there's a lot of barriers when it comes to that, and there's a lot that needs to be done. I think maybe since I've spoken a lot,
we move it to Tera.
Yeah.
Tera, I'm curious.
Yes.
I have two questions. Number one, we've had like the home test kit for things like HIV, yes?
Sure.
Where you are allowed to go test yourself as much as you can and as frequent as you can.
Sure.
Can you term that as self-care?
Yeah, I believe that you've started with a HIV self-testing kit.
Yes.
There's a term self.
Yes.
Already there's a form of self-care. Because it's non-judgmental, because it offers you privacy in a manner that you can be able to know your status without the knowledge or provocations from the surroundings. So self-care has been advanced in several ways. As I said earlier, we have the digital health as a form of self-care. In terms of digital health, we have the various platforms that youths can get the services that are available. So HIV self-testing kit is one of the forms of self-care. We have the HPV self-testing. HPV enables our adolescent girls and young women to test for cervical cancer. We have even self-injectable contraceptives.
Contraceptives, yes.
Yeah, so you can just inject yourself from home. We're championing also for self-collection of specimens, like for gonorrhea and syphilis. You can just collect by yourself, then take it to the doctor without being judgmental to you on how you collect it. Yes. So there are several ways that we are championing for access to self-care in terms of services. Yes.
When earlier said I have two questions.
Yeah.
So that's the first one.
Yeah.
Why I was asking you that question is because number two, where do you draw the line? Where do you tell, I have tested myself, do I need to now my condition is positive, do I need to go see a doctor? Or now that I know I'm positive, fine, I can live with it. Or if I am negative, do I need to continue to go see a doctor maybe for further tests or anything? Where do you put that line and say, now I know my situation, I know my condition, what do I do next? How do you tell the difference? You've done the self-care, umejipimia kila kitu, umepata results zako. But then, moving forward, next.
So I believe in the beginning of the conversation, we spoke about education. And you know, education as an art is a social vaccine. A vaccine is something that prevents you or prevents a prevalence of a disease. So education is a social vaccine, and you can agree with me on that. So first thing that we advise on self-care is be informed first. have the information, have the correct information on how you can go through if you get the instances of either the negative or positive cases. So first of all, you have to be informed on the relevance of having self-care. Why do you need to have the service, and how do you go after? So we have 3 steps where we have capacity building or counseling. We have referral. Then we have follow-up. So in terms of the referral part, the counseling part, we equip you with information, the relevant information that you need to know on the kind of service that you're going to take. Referral part is where we refer you to a service provider, where you'll get the necessary product or drugs you're going to use. Then follow-up part comes in where we as reproductive health champions, we can follow up on the individual that we have referred, or we have integrated several systems where Pamela mentioned that we as Reproductive Health Network Kenya, we have the Nena na Binti platform. Also, we have partnered with several organizations. We have Daktari Online, so you can get information from several platforms that can guide you on how to go whenever you meet an anticipated case. Yes.
Pamela.
Just build on what you said.
Yes, please.
When we say self-care, it's not about self-test and then sit at home. Like, after self-care and there's no treatment, then what's the point? You know. And I began by saying this is with or without the support of a healthcare provider. And for self-care to happen, there's a lot of things that need to happen. We need to work together. First of all, like you said, we partner with CSOs. We need to, with other organizations, we need to even partner with the government. It needs to be a holistic approach in a way that after I test, I know I have gotten a positive, but it could be a false positive.
I was actually about to tell you a story that I saw on social media, I think a week or 2 ago, of an individual who self-tested at home, then it came out positive. Then he decided, let me go to see a doctor and see if the results will be different, and they were actually different. They came out negative at the doctors, but the kit he used at home came out positive.
So, you know, there's a lot that contributes to that. Maybe even the testing procedure he used was wrong or something. He or she used was wrong or something. But we always say, if you get these results that you have at home, what next? You need to go to even the lowest cadre of providers, even if it's a community health worker. Tell them, this is what I've gotten. Where can I go to confirm my results? Who is accountable for those false results that you're getting at home? So we need a holistic approach where we see how we can be accountable for these people, how we can refer this person from the community health worker to a facility. And we always say that if you're practicing self-care, be attached to a healthcare facility, because what happens if you have side effects? What happens if you do something wrongly and you don't know where to go? So once you get your self-care intervention initiated at the healthcare facility, we usually advise you be linked to either a community health volunteer or a health worker or a health facility, so that in case of anything, you are able to go back to the health facility or contact someone and just tell them there's something that has gone wrong. How do I go about it?
Tara, she's talked about accountability, which leads me to the question, what are the legal frameworks that are in that area of sexual reproductive health, self-care? What are the functional legal frameworks that are there? Because if you get a positive result and then you go to a hospital and it's negative, one, it's really messed up your mental state. The amount of thoughts you've had in between that journey from your house to the doctors, you've even contemplated suicide at some point.
So I believe Kenya, we are way ahead in terms of laws and policies, but we need to have some good implementation frameworks in place, because I'll begin with the supreme law in the land, which is the Constitution. The Constitution under Article 43, it categorically says that every person in Kenya has a right to the highest attainable standard of health. And it provides the stipulations. Under Article 26, it even categorizes cases where someone can access certain services Yeah. So I believe we have several policies in place, even the Health Act policy of 2017. We were during COVID, we were given the guidelines on how one can get services in terms with the continuation of COVID. That was applied to the lower cards of service provision. We have an Kenya e-health strategy policy that was launched in 2020. That applies to the ICT departments of the government because it provides negotiation for digital health both at the national settings and at the county levels. So the conversation that we should be having and collaboration with partnerships with the government is that how do we promote now the implementation of these policies, because we have good policies, but we lack strategies to implement them. Yes.
Okay.
Can I build on that?
Yes, please.
Globally, we have the WHO consolidated guidelines for self-care, and that covers like the whole world. So it will look at self-care in terms of contraception, the general sexual reproductive health, in safe abortion. It looks at it holistically in terms of self-testing, self-awareness, self-management. But we cannot always use what is global because we have our own issues here in Kenya. We have to domesticate it to a way that fits into our country context,
Yeah.
So we have a gap that we don't have a specific guideline here in Kenya that speaks to self-care. Though I hear there are conversations that they are being developed by the Ministry of Health, but currently we do not have. And as he has said, we are just picking from here and here. There are bits and pieces of self-care in the policies and the guidelines, but there's no clear guideline that guides us on self-care.
Yes.
So that is a gap. Yeah.
Allow me to read some feedback. We have Mtoto Mariam, Kindiki is a happy man. I agree, that was on the news updates earlier. Elijah Kimani watching from Kandara, Muranga. Thank you so much for joining us. Mose Saika, well represented. Thank you. We have Fabio Wanjohi. Does self-care apply to men? Tara, does self-care apply to men? I don't want to answer that.
Yeah, I believe self-care is holistic in a manner that it cuts across all genders. Because in a sense that we have cases of incorrect usage of condoms.
Yes.
I believe we have the female condoms and we have the male condoms. And in the case of male condoms, we expect it's males who use the male condom. So we have cases where male condoms don't, they're not correctly worn.
Yeah.
Yeah. So I believe you wear it yourself, so it's a form of self-care.
Yes.
Yeah. So definitely we need to equip these our male fellows with the correct information of how to use the several services that we have for the males in the community. I believe there is a conversation going around on marriage stops. Wow.
Yes, they have free vasectomy services this week.
Yeah.
Yes.
Yeah. So
that is also self-care.
That's self-care.
So you're wondering how is vasectomy self-care? It is.
Sure.
It is.
Yeah.
It is. I'd like to believe women are the ones who take up almost all the responsibility in regards to contraception, family planning, and all that.
Sure.
For the men who are taking it up, it's a good step.
Yeah.
Releasing some baggage off our shoulders.
Yeah. We call for male involvement.
Yeah.
and researchers need to also do a lot of research on men contraceptives. I mean, we have a whole lot of options, and then men are just like,
imagine.
Like it's like the game is on one side.
Yes, it has always been. It has always been on one side. Yeah. Allow me to build up on what you've said in regards to men's self-care. Earlier on, as I was starting, I spoke about HPV.
Sure.
It is known that men are the carriers of the HPV virus. It does not affect them, but then upon sexual interaction with a woman, it's the woman who acquires it, and later on it builds to cervical cancer.
Sure.
So if a man takes care of themselves not to, I don't know what, I've not read really deeply into it on what a man can do not to be a carrier, or if you are a carrier, you are born. I don't know. I honestly do not know. I think that's also, taking care of themselves
I believe in terms of even HPV, we have a conversation around bacterial infection.
Yes.
I believe even most men tend to be carriers of bacterial infection because it doesn't appear to men. The incubation period for men tends to be longer than the incubation period for females.
Yeah.
So as a form of self-care, it's good for our fellow men to have frequent checkups on methods of keeping themselves safe by testing for bacterial infection.
I was even about to ask you, do men go see their doctors as frequent as women go see their gynecologists? Do they?
I think we do have a more health-seeking behavior because we are more prone. We are always so vulnerable.
Yeah.
Something small, you go to a wrong toilet,
you're done, you have a UTI.
So I think...
So I believe we should cultivate a notion of a health-seeking behavior amongst our male friends.
You don't have to be sick to go see a doctor.
Yeah.
Sure.
They're called urologists. What are they called? What is the name of a sexual reproductive health doctor for men?
Oh wow.
There is. I think it's urologist.
Really?
What is it called? Wait. Carry on as I Google.
So I believe we should keep the conversation among our males in ways they can champion for their own self-care, because we have a notion of stigma amongst men. Juu utapata conversation inaendelea ground, alafu mtu anakuuliza pia wewe unaanza kuona daktari juu vitu kama hiyo kidogo. That should not be the conversation. That sounds like a stigma. It's a taboo because it was built.
If the doctor does not even have a name, it is serious.
I believe we share the name.
Againa, really?
I don't know. I feel like they can also.
They can also have theirs, right?
Yeah.
Are we being mean? No, we're not being mean.
Yeah, so even as you're saying, I feel like even when people get into relationships and you are sexually active, I usually advise that I would rather go with your partner to a provider first.
Have all the tests done.
Yes, have all the tests done. We cannot be risking all the time and praying to God to protect us. Let us go to the provider.
One chance. Give me a last chance.
In terms of infections, in terms of pregnancy, look for a contraception method that works for you. And the good thing about self-care, what I was saying at the beginning, is you go to the provider, to a health practitioner. They give you all the options. So you decide, I know maybe I'm not good with taking pills. So, daktari, mimi nipe IUD. And then you'll be like, I know I have multiple partners, so mimi IUD sitawezana nayo. Maybe give me an implant, So you know yourself better. After the doctor gives you information
that you need,
you can be able to tell the doctor, according to my lifestyle, this is what I want. Yeah.
Tara,
yes.
And I've just seen, I've hung kidogo because I've just seen the meaning of a urologist. A urologist is a medical doctor specializing in conditions that affect the urinary tract in men, women, and children, and diseases that affect the reproductive system. Oopsie, I am sorry, I have learned something today. So it is general.
Yeah.
A urologist is general.
Yeah.
Cuts across.
It cuts across. So also I'd like to assume a gyna is the same. But imagine a man telling you I'm going to see a gyna. Okay. That would sound very weird.
So we need to demystify that.
We are also selling stigma towards the men.
Yeah.
You can add, maybe you can build up on what she said in regards to in relationships, how you start off.
We're championing for self-care in terms of for young people, because a research was done and under KHDS, and it tends to say that the sexual debut among our youths is between 15 to 20 years. They tend to have their first sexual encounter between the ages of 15 to 20 years. So I believe we tend to have a gap among the rural, specifically the rural youths who don't or who are not equipped with the correct information on how to go while they're engaging in the first sexual encounter. Because even the same KDHS says that 1 to 5 girls in the ages between 15 to 19 years is either pregnant or she has had the first child. So you see,
between 15 to 20.
15 to 19 for girls.
Oh,
1 in every 5 between 15 to 19 years.
Okay.
Yeah.
You're either given birth or you're pregnant.
You're pregnant. Yeah. So you see, we have a gap. We have a gap that we have to cover. Now, these can only be covered when we equip our adolescent girls with the correct information, because they tend to engage in these or in the unsafe acts because they lack information, and then they tend to be equipped with information in a later age. So it creates a gap in terms of even addressing our services, access, and even championing for the relevance of the low health providers at the grassroots levels. Yes.
Well, as we are winding up, Pamela, maybe talk to the young people, tell them something in regards to self-care.
Wow. Which camera? The young people. Self-care is very important, and as young people are facing a lot of issues in terms of accessing sexual reproductive health and services, and my advice to you is that self-care is very important. Self-care has the potential to solve some of these issues we are facing, some of these barriers we are having in the healthcare system, the gaps. Self-care has the potential to solve that. So just make sure you're getting the right information from credited sources. If you are not sure about the information you are getting on Dr. Google, please go to a healthcare provider or text us on Nenana Binti or call us at 0800-211-227. We'll be able to assist you. Make sure you're getting the right information. Make sure before you do anything you have consulted, because there is potential for abuse for these things, so we need to be regulated also. So just make sure you're getting the right information, make sure you're doing the right thing, you're adhering to what the doctor has said, and we'll be good. Yeah.
Maybe give us the hotline one more time.
The hotline number. We are Nenana Binti. You can call us. It's a toll free. You don't need airtime. So 0800-211-227.
For all men and women.
Yes, you can call. Even there are people we even get calling us, "Hapa ni patanisho."
Oh, wow.
Yeah. So anyone, if you have issues, you need someone to talk to, you need advice on sexual reproductive health, you need information on contraception, any sort of information. If you feel overburdened and you just want to let out, feel free to call us. Yeah.
Tara?
I'd like to begin with the national, county to the grassroots level. So for national government, we need to put in place policies and structures that won't restrict our adolescent youths in terms of accessing to information and services, because we have an issue with gaps in ages that tend to ages that are legally approved by the government for uptake of services, but we need to regulate that. At the county levels, we need to have a much more comprehensive form of primary health care that will champion for a much accessible and affordable services at the grassroots levels. And to my youths, my fellow youths, and my fellow to our adolescent young people, you just have to acquire the correct information from accredited services, as Pamela has said. If you have any concern or if you have challenges in terms of sexual reproductive health, you can reach us on Nenana Binti, both on Facebook, Twitter, and Instagram, and also through the hotline. Yes.
Where do we get you on social media?
The Nena or us?
Both you. Maybe there's someone who would want to reach out to you specifically, or they would want to reach out to the organization through social media.
You can reach out to us at RHNK, Reproductive Health Network, on Twitter. I am Pamela Adiambo on Twitter. And you can also get us easily on TikTok, Nenana Binti TikTok. We do a lot of shenanigans there to just make sure you are informed. So you can also DM us there. And even on Instagram, Reproductive Health Network Kenya. Yeah.
Tara?
Sure. You can get me on Facebook at Tara Keith, on Twitter at Tara Keith without an underscore, and on LinkedIn, Keith Tara. For our organization, we cut across. Reproductive Health Network is on LinkedIn, Facebook, Twitter, and Instagram. Reproductive Health Network Kenya. Yes.
Well, thank you so much for joining us.
Thank you.
Thank you for sharing with us the knowledge that you have. We really appreciate. Looking forward to having you again and again in the future days.
Yeah,
I appreciate
thank you.
That's Tumeshukuru sana. Thank you so much for tuning in. We've come to the end of our first launch. Stay tuned. We will be coming back with the founder and director of Vera Beauty College, who will be joining us after this show. Thank you.
Thank you.
That was really nice.
Vera Beauty and Fashion College is focused on being the leading technical and vocational training institute in the region. Our team possesses in-depth knowledge and extensive experience in the industry, offering thorough training in cosmetology, hairdressing, interior design, creative arts, training of trainers, nail technology, and fashion design. With branches in Nairobi, Thika, Meru, Eldoret, and now in Mombasa, our courses ensure that learners are completely equipped with knowledge, competency, and employability skills. Enroll today to be a part of a center of excellence.
Welcome to Children's Corner. Welcome to
Children's Corner.
Children's
Corner.
Bila shaka mbiu ya mgambo ikilia, kuna jambo. Na sasa katika QTV Rise Today, makala ya TBT, tunaongeza kuni, tunawasha moto. Tunaingia barabarani kuangalia hali ilivyo, takwimu za korona na kupa habari zinazojiri na zinazokuhusu na kujuza na kukumbusha yaliyotendeka siku kama hii ndani ya historia, kisha na kuletea wageni na wataalam, tudadavui, tufahamu na tuchukue nafasi yetu kama vijana katika uongozi, uchumi na masuala ya kisiasa nchini. Na joto likizidi, tunaingia uwanjani, tunachambua spoti ya Kenya. Ni kila Alhamisi saa 1 hadi saa 4 asubuhi, nami Vincent Maina almaarufu Ojwang mtoto wa Mariam, ndani ya QTV, a new experience.
Who is your celebrity crush?
Glenn Weiss.
Oh, okay.
Ask me about Glenways.
Tell us about Glenways.
Glenways is a award-winning director and a producer. He has done so many projects in the US, in the UK. He's a VMA Awards winner. He's a BET Awards winner. So he's my celebrity crush.
Oh, wow. How does it feel to live your dream?
It feels so nice. You know, at first I didn't know I will become a director.
Sasa ni bora zaidi, mwanzo mpya, mambo mapya. Msimu mwingine wa Boresha Kilimo unakuletea teknolojia ibuka, kilimo mseto, uongezaji thamani. Teknolojia dijitali ya mauzo inawezesha ufikiaji wa masoko. Soko moko yako, mahangaiko yako ya kufikia masoko yamefika kikomo, manake tunao Mkulima Yangu.
What Mkulima Yangu does is it connects farmers with the market.
Hii ni Boresha Kilimo kwa ushirikiano na Mkulima Yangu. Atafutaye hachoki na kichoka kesha pata. Kwa makala maalum ya kilimo, ungana nasi kila Jumamosi saa 6:30 kwenye kipindi ukipendacho Boresha Kilimo.
Ukiwa na dukuduku la michezo, tunafungua sanduku la dukuduku kwa ufahamu zaidi. Kila danadana, mitimko, mifiatuko na harakati zote ugani, sisi ni wako mwandani. Kukurukakara zote nyanjani, haziwezi kuangaziwa zaidi ya micharazo michezoni. Mimi mwanaspoti wako matata Peter Pinches Mwaora, ndakuwa na jopo lenye maarifa sufufu, nikufahamishe na nikuburudishe wewe shabiki shakiki kwa uhakiki na kindakindaki.
Maelfu na maelfu ya wahamiaji wakiwa na watoto kutoka nchi za Amerika ya Kati wanaendelea kuwasili kwenye mpaka kati ya Marekani na Mexico.
But folks, I'm going. Thank you very, very much. I appreciate it. Thank you.
Ni habari kutoka pembe zote duniani.
Pepo pasi kukufuku, pepo pani idea.
Tazidi ananyonya, hanyonyi vizuri, anakuwa hayuko comfortable.
Jeshi la Jamhuri ya Kidemokrasia ya Kongo linapambana na waasi wa ADF.
Chanjo ili ina boost ama inanyanyua kinga ya mwili, ndio inaenda kupelekea kupambana na virusi.
Ni duniani leo, Jumatatu mpaka Ijumaa, moja kwa moja kutoka VOA Swahili, Washington DC.
Naye akamwahidi Mwenyezi Mungu kwamba ikiwa mimi umenilaani, mimi umenifukuza, mimi umenitoa katika rehema yako, basi nitaenda katika hii dunia, lakini nami nihakikishe siingii motoni peke yangu, bali niwe na wafuasi. Lazima nitafute wafuasi, kwani huo moto nitakuwa nimeombewa mimi peke yangu.
مولاي صل وسلم.
What is this magic? I need that magic.
Somebody call 911.
Welcome back. Thank you so much for joining us. I really do appreciate your feedback. I have such an amazing guest with me here in studio. I feel so privileged. You guys have no idea. But right before this show is all about women empowerment, strong women and growing women. We do appreciate you men, we do, but as of today, please allow me to be selfish. Allow me to be selfish. Today we are appreciating strong and powerful women. Right before I introduce to you my special guest, allow me to read some feedback. You have Richard Okenya. Good morning, Nina, here for unfiltered conversations on sexual health. I hope you enjoyed that. Ojwang Mariam Okenya, I have seen these are two of our hosts here for Tuesday and Thursday. Have Glam by Coco. I am so excited seeing Pamela there. Thank you so much for tuning in. Billy Kirui Odrori, thank you for joining in. Diana Mongina, congratulations, Pam. Mwangi Steven, happy seeing Paul there. Great and powerful insights. Earlier on, I had hinted that I have the founder of Vera Beauty College. Vera Beauty College is a very big name out there. It's a powerful name out there. And I have Madam Alice Kamunge with us. I'm feeling excited. I feel elated to have her here. Thank you so much for joining us.
Thank you. I'm happy to be here.
And for taking your time to be with us this morning, this very early morning. Karibu sana.
Thank you.
Earlier on, just right before we started, you were telling us about your story.
Yes.
Right before we get into Vera, maybe take us through where you started. Vera is such a big name. It's such a big brand, yeah? Maybe take us through where did Alice start? How did Alice start by founding or finding Vera? Who was Alice before she was the CEO and the founder of Vera?
Thank you so much. Thank you for honoring me with this invitation. I really can't take it for granted.
It's a pleasure.
And I'm very happy. This is my dream come true. I've always wanted to come to speak here. And the first time I came here, I loved the place because I like growing with the people.
Yes.
And when I came and I found a young TV station, and I told Akina Tony, please can you invite me to come and talk
here? Yes, it's actually a privilege to have you here.
Thank you very much.
Yes.
Like she said, my name is Ambassador Alice Kamunge, and first of all, let me say I'm ambassador for water and sanitation because I love environment. I love taking care of environment. I love planting trees, and that's my passion. And apart from that, yes, Alice Kamunge. Alice Kamunge is a very humble person, and I grew back in the village, Meru, and Vera Beauty. My story is something I'll come to tell another day. But let me start by saying Vera Beauty and Fashion College is that dream. That dream I usually tell people, and I tell young people and everyone, that if you have a dream, it doesn't matter how small it is, grab it and hold it dear to your heart and keep dreaming and focus on that dream, and one day to come true. That was me and Vera Beauty and Fashion College, because I dreamt when I was very young in standard 5, way back in 70s, you can imagine.
Wow.
Yeah.
Wow.
Way back in 70s, that's when I dreamt learning something where people are so beautiful and people are so glamorous and people were like, and when I woke up in the morning, I told my mom I was in heaven.
Oh, wow.
Yes, I told my mom, last night I was in heaven because I saw heaven. Heaven is so beautiful. And because I was seeing beautiful ladies with very beautiful hair, nice makeup, and they were walking like on the runway, and I could see lights which were everywhere. And to me, that one was heaven. And I held that to myself, and I held it so dear, and I kept on searching for that dream because I saw myself in that dream. And surprisingly, it's me who was being applauded by people in that dream. So I kept that dream alive, and I searched for it until one day, through my husband, whom I hold so dear to my heart, because everything else was not working for me. But when I got my husband, who I hold so dear to my heart, he told me, look, is this your dream? Just fly. And he gave me the wings. And that's why we say Vera Beauty Orange, the wings. We have somebody beneath those wings. There's a gentleman out there who really kept me going and telling me, you can make it. If this is your dream, you want to make people beautiful, go on and
go for it.
Why do I say my husband? Back then, when we used to, you couldn't tell anyone that you love doing hair and dressing.
Yeah.
You'll be told to go outside to the field, and you can go and ukashuke nyasi inje.
Yes.
You understand? Because you couldn't tell a parent that you want to study hair dressing, for example.
They didn't used to take it like
you
a serious
thing. Anybody, even your friends, that you love making people makeup, for example. You'll be told you are a prostitute, you are what? Go to Koinange. Because that's where we used to see people with makeup and nails like these ones.
Yeah.
They were found in Koinange. So you'll be told go to Koinange. So it was disgraceful. You couldn't even talk about it. To the point that even when you are with friends and with your in-laws, for example, your mom-in-law will tell you, don't introduce yourself. When you're introducing yourself, don't say where you work. Don't say what you do. Because it was
a disgrace.
It was a disgrace to the family. It was a disgrace to
the community,
to the people around you.
Yeah.
But there's one man who stood with me, and he gave me the strength and the wind beneath my wing, and I started flying because he told me, if that's what you, and he protected me. Anytime anybody will attack me on being a hairdresser or a beautician or fashion, fashion, people used to know fashion is those fundis who used to stay outside the shopping centers repairing clothes.
Yes.
That's what people knew back then. It was very bad. But because of him, he gave me the wings to fly, and I knew that I could fly with what I wanted to do. And slowly I started starting small salons. I went to school to study hairdressing, and when I would come home, I wouldn't want to tell anybody where I was, but my husband knew where I was. And slowly that I started training house helps, because I opened a salon in my backyard, and I started training house helps. After they finish their work, they'll come. I trained them, and I used to believe if you're earning 1,000, because those days you'll be even paid 500. These days I see you employing house helps and you're paying them 20,000, 15,000. We used to pay 500, 1,000.
But at the time, the money that was a lot of money at the time.
The money and the meaning that time. So I would train you and tell you, if you learn how to braid and plait, if you go back home to Kakamega, Kitare, wherever you go, you can't
make an extra coin
to make more than 1,000 in a month.
Yes.
And that's how I began. And before I knew it, and like 10 houses coming to train. When they finish their work, they would come and train.
Yeah.
And that's how I started thinking, you know what?
I need to start a school.
I can start a school.
You are gifted.
Yes, yes. And I realized that was a gift right there. And it reminded me of my dream. And I remembered people applauding me and I was the star. In that room, I was the star where everybody, people were walking and looking stunningly beautiful with their hairs made and makeup and the clothes. I said, this is it. This is the time to realize my dream. And I went and dusted that dream where I had kept it in my heart. And I dusted it with the help of my husband, of course. And slowly, I found myself with Vera Beauty and Fashion Courage. But there's something very special with Vera Beauty and Fashion Courage. That word Vera, there's something very special. It's a very special name.
Please share with us, please.
Because Vera Beauty, was a vision which was brought to me because, you know, when you are training a course which people despise, there's something which everybody, you feel you are walking against the current, you know, and the current is pushing you back, and you want to move forward. So it was not easy even to start it or even to train. That's why I started training the ourselves, and it was very difficult. But so I asked God, I said, God, you know, I want to have a name. I want to, now you have told me that it's the time for me to open the school because I've seen the results, the progress of my, even actually what happened is I trained a girl who was very, very frustrated where she was working. And through the training, after she finished training, a friend of mine came and she picked her and she went with her at Karen, Runda, those signs of Runda. She employed her. And when we met with my friend after like 3-4 months, she told me, you know the girl you gave me? Do you know last month she earned 25,000? That blew me, you know. I said,
I just making hair and makeup.
I knew it, and I said, this is it. This is exactly what you
were called for.
Yes, because this girl was earning just, she was earning 1,500 where she was working, and now after taking this training, she's earning 25,000. So I said, then which other job can I train? What else can I do to help people become better, if not this, from 1,500 to 25,000 per month, you know? And that now made me feel the urge to start the school.
To keep going.
And to keep going.
Yes.
So I asked God, I'm a very prayerful person.
Yes.
And I thank God for everything, because through prayer, if you pray and you keep praying, even when in difficult situations you pray, God answers you and gives you a vision and answers your desires.
Yes.
Because as I was praying, I told God, you know what? I want. You have shown me that I can now learn a school. Now I want you to give me a name, and this name I want you to give me. I want you to give me a name which is healing, which is soothing, which, when I mention it, I feel healing in my heart, because I'm hurting. People have hurt me so much, you know, because when you say you are a hairdresser, people laugh at you. When you go home and you say you have stopped doing what you are doing, and now you are doing hairdressing, people wanakudharau.
They don't take it. They don't take it as a career.
So they don't take it as a career. So I said, God, give me that name, which anytime I mention that name, it should be a healing, a soothing name. And I was taken it was not as a dream, because I was not asleep, but I was taken
like a vision.
And I saw cactus, red cactus this side, and then when I looked the other side, I saw green cactus, and I was told, that's the name of your school, and it will be soothing. It's a soothing name. It is a healing name, because whoever finds it, the rich and the poor, they benefit from it. And then the past. Then I asked myself, what was that? Then the name is that one, the red cactus and the green cactus. But it took me some time, like 4-5 months. We were on our way to Nyahururu with my husband, and one day did I see that ocean of red cactus. And then I asked my husband, what is this? He told me, those are aloe vera.
Aloe vera.
Descent aloe vera. Then I said, this is the name of my school.
This is what you were looking for.
Isn't it? And when I looked at the other side, here the aloe vera, I know this aloe vera, but I didn't know this aloe vera, and that's what was confusing me. So it's when I said, this is the name God gave me. Yes, it is true, because aloe vera, the desert aloe vera, every animal eats desert aloe vera before they go to give birth, because it's a healing. It has a healing, components which heals when you give birth.
I also didn't know that. I've just learned that.
Yes, the aloe vera, it's a fantastic healing, plant, and the poor can afford, and the richest can afford, because the most expensive product in the world has aloe vera in it. You understand?
Yes.
So, and the cheapest person, animals in the desert, they can still afford aloe vera.
Yes.
And anyone can afford aloe vera. the poor and the rich, and it is a good plant. And I saw, this is the name, and that's how Vera was created.
Was born.
And I removed aloe, and then I called it aloe vera. Even my logo, the logo of Vera Beauty, which grows, the hair grows on a cactus. That's why that V is the cactus of aloe vera.
Aloe vera is also really good for hair.
Yes, that V is a cactus of aloe vera with the way I saw it, because I saw the end coming from the cactus of aloe vera, and that's how
Vera was born.
Vera was born. So the logo of Vera is very special, and the name Vera is very special, because I thank God from the time we started Vera Beauty and Fashion College, it is a home to the people who come to Vera. Anyone who come there, and you have seen so many young people come, even there are so many who have come when they are so devastated in life, they are depressed,
they live better, they live happy,
they gain a lot, they change. We have seen so many of them come and they change. We have seen so many who have left home because they are frustrated, and they come and they change, and they come to give a confession. They say later.
Testimonies.
The testimonies of, when I came there, I was like this, and nobody, I can't believe, I didn't believe that I couldn't change. I came there and I changed. Now I'm a change person, I'm good, and they are doing very, very big businesses out there, and that makes me feel so happy that name Vera Beauty
is a healing space.
The school Vera Beauty is a special school, and that's how Vera Beauty was born.
I love how you are so on brand. I mean, look at her talking about beauty, talking about dressing and makeup, and she looks the part. We must all agree she looks the part. You look very, very amazing. Now let's get into Vera, the services that Vera offers. It's a college, and it also offers the services.
Yes. Vera Beauty and Fashion College actually is hospitality college.
Yes.
Because we started by training hair and dressing, beauty therapy.
Yes.
Then we introduced fashion and design, because when you are starting a business, I will advise the people, especially the upcoming business people who want to start their businesses. It's not good to start with so many things at the same time. You start slowly and growing and adding and adding. Our institution, Vera Beauty and Fashion College, being a hospitality institution, we want, there's where we wanted to reach, but it's where we began.
Yes.
We began by training and dressing, everything to do with the dressing, braiding, plaiting, weaving, bonding, relaxing, hair color, texturizing, styling, all that, everything to do with hair and dressing. And then the beauty, in the beauty we teach manicure, pedicure, facial, makeup, eyebrows shaping and twisting, and the extensions, body massages, and tattooing, and everything to do with beauty. Because beauty is anything you do on your,
as an addition to your natural beauty.
To hand beauty to yourself. We call it personal grooming. And now we have introduced nail technology, because we keep scanning the market. Anything which is trending, we hand it to our training, so that we make our students, the ones who are living, better. So we have to keep on scanning the industry and the market to see the needs and the demands. So we keep on adding. Then now after we strengthened hair and beauty, we introduced fashion and design. Fashion and design is where we teach our students how to make everything to do with fashion, from the clothes, from the suits and dresses, wedding gowns, and evening gowns, everything to do with the accessories, handbags, shoes, and everything to do with
everything. You do everything from head to toe.
Yes. So when a person comes for 2 years, by the time they leave 2.5 years, they can do anything. They can make anything in fashion, including accessorizing that garment, and including the wedding gowns. And we introduced also event decoration and flower arranging. Event decoration and flower arranging is where someone like can do a wedding. You can go and decorate a wedding, do the swatches and and the flowers and everything. And we teach also event planning. Event planning and management is for that person who owns the strings of the event together. When you want to be an event planner, you are the one now who knows where to get the caterer, the flowers, the tents, the cakes, everything. Now that's the planner. The one
I happen to be an event planner myself.
Yes, that's very good. Now you understand.
Yeah.
Now that person is called an event planner.
Yeah.
But an event decorator is that one who is one component of an event.
Yes.
Where you come and then you are taught on how to do to decorate the event.
Yeah.
To decorate a wedding, to decorate birthday, to decorate events,
Weddings,
anything.
graduation.
Yeah, even political whatever events. And then apart from now event decoration, we introduced also baking, because we wanted this event planner to come to Vera and pick an event decorator and a baker. So we teach baking, where we teach them about yeast, about pastry, and the cake making.
Now that's where the hospitality comes in.
You know, we call it hospitality because dressing is part of hospitality, because I prepare you to face the world. I'm taking care of you. It's part of hospitality. It's a bigger whatever, because people say hospitality. When you talk about hospitality, they talk about,
just think about food and beverage.
Yes. And housekeeping and the like.
Yes.
But you know, hospitality is even also, it encompasses also this person. So even hairdressing, beauty and fashion, we coined it together, and we called it now ours is a technical school, but concentrating on hospitality courses, which hair and beauty and fashion is part of now the baking and housekeeping and front office and all that, which is in business. So that's how we coined Vera Beauty and Fashion College courses. Apart from now the other courses we teach, like we teach how to TOT, like training of trainers. We teach how to be front office officer, business administration. The courses which are relevant to our main core businesses. And then we teach also entrepreneurship, because in the courses we teach, hair and beauty and fashion college and even baking, there are courses you can learn and employ yourself.
Yes.
You don't need to go looking for a job. And that's why entrepreneurship training comes in very handy, to teach them our trainees on how to do their own businesses, how to learn their own businesses, may it be opening a shop or doing a house course and all that. So those are the courses we offer at Vera Beauty and Fashion College. And the beauty of the courses we offer is everyone can do those courses, from the people who are going, the people who have never been to school, the people who fell in between the school and high school finishing, the people who have gone to the university, the people who are working, the people who are retired. Everybody can fit in these courses, because they are courses which can help you have a side hustle. Regardless of whether you are university, like now we are here at the university, if the students here take a short course, for example, of nail technology, just doing these nails, or makeup, just that, nothing else.
It's a plus.
It's a plus, because those days you are free and you are doing nothing and you don't have a class, those are what you can do. Instead of going to idle, you can even go to your cubicle and call a few friends, make their nails,
and charge them.
And by the end of the weekend, you have your 10,000, 20,000 pocket money to last you the other week.
That's true.
You understand? Including even makeup. So these are, even if you are working and you have a free time, you do nails or makeup or beadwork to know how to make earrings, like these earrings and the like. It's something you can do even when you're at home in the evening. And you can do it, it's a side hustle. For the people who are doing something else, the courses we offer, they can give you a side hustle which can earn you more money than you are earning at your regular job.
Yes.
You understand?
Yes.
And that's the beauty of the courses we offer. And you don't need to be employed by anyone. You don't need to open any shop. Light your table in the house, you can do bids.
And we're in a good era because mobility, you can go do it you can go to the customer's
this
place.
Is it.
Yeah.
And when you do these things, for example, like what I'm saying, for example, you do tie and dyes. If you come and learn a course, a small course of 2 months, tie and dyes.
Yes.
Tie and dyes is something you can buy materials in Italy, come buy your caustics, come and do it. And sell even to your friends here, the table mats and what, all these t-shirts, what. And you make a lot of money out of it. And it's a course which you did only for 2 months. So that's what I'm saying. Everybody fits in the courses we offer. If there are students who did not go to university, going to technical schools, even going to technical schools as you are waiting to join university, is what I encourage young people to do. Because when you take a technical course, like for example what we offer at Vera Beauty, your pocket money is guaranteed when you go to join university.
You can pay your bills.
Yes, you can pay your bills comfortably because you spend your weekends and free days when you are not in class doing something to make money. So that's why I call everyone, even those ones who are thinking that, oh my goodness, I'm retiring next year. Don't bother, don't worry. Come to Vera, train something, learn something, learn beadwork, learn waxing, learn makeup, learn nails, learn something which you can go like mamas.
Also to keep your mind busy as the time goes.
Yes, and when you do it, today with the digital era, you can post them
on social media.
And you find your craft being bought by people from all over the world.
Yes.
And you can shape them. These days it's not difficult to shape. And you find yourself earning money from something you thought was just a side hustle.
Yes.
So that's what I normally encourage people and tell them. We not only do we have courses which are lasting 9 months, 8 months, or 15 years, 15 months, 18 months, 25 months, but we have short courses which are very, very productive for anyone, and you can learn them anywhere in Vera Beauty and Fashion College branches. We are in Nairobi, we are in Thika, we are in Meru, we are in Eldoret, and now our new branch, we are in Mombasa. And all those courses, the short courses, the long courses, you can get them there and they can help you a lot.
Yes. To back you up a bit, in the recent past, we've had our leaders talk about how universities, they teach these tough courses, engineering and all that, but then after you get your degree, what next? So they were really emphasizing on getting young people into technical colleges to learn the technical skills, like you're saying, to further their education, to be able to make their own money, to get into the industry and not just, hold your degree in your house for years and years and not getting a job, while you can go to a technical college, learn some skills, and further make your money from the comfort of your home, from mobility and all that. And also I wanted to ask, do you also offer ICT?
Yes, we do. We offer ICT, which we have just introduced now, where it's actually even mandatory for the government. They introduced something we call digital literacy, which we are offering not as a major course, but we make sure that it's a unit which our students cover. Yes, we cover it as a unit. We call it digital literacy, where our students, you need to learn how to market yourself, how to do digital things, how to work on the net, but not ICT itself. We don't offer ICT itself, but we call it digital literacy. Yes. Yes.
I'm so curious because you've been in the game for a very long time, and I'm sure you have seen beauty evolve. Many years back, maybe we were not wearing lashes the way we wear them now. We were not. There is the individual installation of lashes that is very common now. There is the nails. what are your thoughts and feelings now in regards to the transition, how beauty is changing year by year? Because I'm sure you've seen the entire transition.
Yes.
You've experienced all of it. So what are your thoughts, your feelings, and what do you think beauty will be like in the next few years to come?
First of all, before even I answer you that, let me take you back. I contribute to about the government or the conversation.
Yes, please.
where we are encouraging people to go technical.
Yes, please.
I will say this: university is very good. Going to university to get degree, masters, PhD is very good. The only challenge or the only mistake we made as a country, and where the rain started beating us, it's where we channeled everybody to university. When you finish, the goal was go to university without looking at what else people could do. Because during my time, it was very easy, because it was graded in a way that if you reach these grades, you go forward to Form 5 and 6. It was a filtering process. That the standard 8, the ones who everybody was going to standard 1, I mean standard Form 1. And the ones who did not make it to go to standard 1, they used to go to Verenji Polytechnics. And when you go to standard 1 to Form 1 to Form 4, if you don't make it to go to university, they were now the technical colleges, where we go to polytechnics and the colleges.
And all that.
Yeah. But the ones who go to Form 5 and 6, it's like they are upscaling. You understand?
Yes.
So there's how the system was filtering itself, conveniently. That by the time you reach in Form 5 and 6, you are even more intelligent. You are academic person. You understand?
Yes.
And those are the ones that who became the managers, the managers and the business administrators. You understand?
Yes.
Then after Form 6, now the choppies, the ones you call the choppies, now will come out and they will qualify to go to university.
Yes.
So you see, it was a triangle. The higher it went, the lesser the people.
It became, yes.
Yeah, the lesser the people.
Yeah.
And it under meaning, because when you are up there, you only need one manager of a project. Like if you're building a house, you only need one engineer, you need one architect, you need one person at the top there. But down here, as you come down, you need very many people.
Yes.
So out here, we need so many plumbers, so many electricians, so many masonry, so many. So that's how it was. And these ones were taught at technical level. So they have gone to the technical colleges, polytechnics, and they learn all those courses. So that now, because the country needed many of these machineries and what have you, but as you go up, we only need one engineer, one architect, one somebody, including even law.
Yeah.
No, you only need one judge, one person, one judge. But down here, you need the clerks and what have you.
Lawyers
There's so many people.
That, yes.
So that's how it was, and it was very easy. When people do, like for example, I've gone to a technical, I didn't qualify with marks to take me to university, and I start with technical. I even become even stronger when I advance to the university. And I say this because we have seen many students who come from university who have gone through the path of technical first. They went to Form 1, 2 years technical, then they joined university. Those people are much stronger when they leave than the ones who go straight to the university. Because when you go straight to the university, it is more of academic, but there is no technical. There's no. If, for example, fashion designer, if I go through a college, 2 years training, diploma, and I get a diploma in fashion and design, and you go straight to Kenyatta University to do fashion and design, and then you come from 4 to do fashion and design. I come from technical college to do fashion. We meet in class. Trust me, I will
the
do
technical
better.
college one will be more skilled.
Yes, they will be more skilled and they
one.
will be better. And when they come out there, they are the ones who are seeing and delivering in a big way. Because one thing, the university has helped them to become better. But the knowledge they had on technical has even propelled them better. So what am I saying? I'm saying both the systems are good. The technical college, we should not now discourage people from going to university and we push everybody to technical. If there's a way we can go back to where we were during our childhood time, where education system filtered itself nicely to the point that even that person who has gone to university, that person who has a PhD, is somebody you respect and you hold so dear, and you, even when you meet him, you respect him because you know the path he has taken. If we do it that way, we'll find that we have people where they are needed. We'll have people working down here with the Form 4 leavers, the university graduates, and everybody, the technical people, everybody will fit.
Yes.
And it will be very good, and people will even be relevant. And people start leaving university, they come out here
skilled,
and they'll be relevant. Now, going back to your question.
Yes.
Of how the beauty has
transitioned,
the transition and how it has evolved.
Yeah.
I'll tell you, oh my goodness, we have come a long way.
Yeah.
We have come a long way from where we used to use, for example, when I started training, I used to use a leaflet from Dark and Lovely. Dark and Lovely combo kit. It used to have a paper inside.
I remember it.
Yes,
I've seen it.
Which was giving this, the directions on how to use, how to do a relaxer, for example, or how to do treatment.
Yes.
Do you know those were the books we were using? Because you couldn't find any book in hairdressing. Not like now, where even you go to the shelves, you go to Salit, you find books and books of hairdressing and beauty. There wasn't. And there was no TV. I mean, there was no digital, there was no internet, there was nothing. So it was very difficult. We used to depend on, like, for example, going on TV, those films we used to be shown on market day, and you see people wearing makeup and eyebrows shaping and nails and all that, and you look at them now. That's what we used to emulate. But slowly things changed, and I remember when I was starting my school, Vera Beauty and Fashion College, there were 4 schools ahead of me, and we had Label, which was very famous then.
Beauty Point.
No.
Beauty Point came after.
Very later. We had Label, we had Kenya School of Hairdressing. That one was the top-notch school. Only the Wazungus and very
who's and the who's.
GIKUNDA funded it. And we had another one called Aphrodite. It was teaching on skincare and Hair Care Academy. You know, where I studied at Hair Academy and Label, and those were the only schools in the country. And I think Vera was number 5. And you can see from that time you could count the schools to today when we are so many. Even where my school is, we are about 5 schools offering
in the same premise.
So there are so many schools teaching hair and beauty, fashion courses. There are so many outlets there. Before, during my time, you could walk in Nairobi looking for a salon where you could be done a professional service. They were not there. But today, they are everywhere, even in the villages, in the shopping centers, in the estate where we live. We have fantastic barber shops. We have fantastic top-notch salons and all that. So we have come a long way. And when we come to talk about the products, my goodness, it's out of this world. Now we are spoiled for even choice.
Yes. Yesterday I saw a joke on social media whereby the young people, we were making fun of, you remember the rose leaf? The red rose leaf, the A-face powder, and people were making fun of how far we've come and how interesting it would be to find someone using a rose leaf palette for eyeshadow or the A-face powder. How times have changed.
Yes,
and I agree.
They have changed a lot that now you can, oh my goodness. Even what is very, very interesting is now you don't have to go to even the salon these days.
Yeah, you don't have to.
You have a salon light on your phone.
Yeah.
That if you want to do makeup, you just go there.
You just Google
and
go on YouTube.
You go to YouTube and you have the answer right there.
Yes.
So it's amazing how everything has evolved. Last week I was invited to an event where we are launching Korea is coming to the market to Kenya, and they want to come in a big way. They want to do the Korean products
are really good.
Korean products
really
are the best.
Yeah,
but they have been trickling into the country slowly. So you can imagine if a country like Korea
has noticed the Kenyan market.
Yes, Kenyan market is
good.
It's good. I think things have changed a lot, and what is very beautiful is people have started appreciating beauty, and people have started appreciating having a makeup artist. People these days, I see them. If you are rich,
personal makeup
the people who have
a full-time job.
Yes. And now people are saying my makeup artist, my nail technician, my barber, my fashion designer. When I hear people say that I want to consult my fashion designer, I want to consult my hair technician, I feel so good that now
times have changed.
Times have changed.
Yes.
That it's no longer
we can
when
openly
we used to be
embrace.
so ashamed to say that you're a makeup artist. Now it's the other way around. That to say you're a makeup artist is something even people are looking at you and saying, wow, you are. So yes, it has evolved in a big way, and I would want to tell young people out there, you don't have to say you don't have a job, because the jobs are right there in front of you. The beauty of doing hair or beauty, you don't have to do the whole course of hair and beauty to make it in life. Pick one. Don't pick even the whole of it. Pick one. 2 months. Learn. And the business is right there in the village where you're staying. Even in your father. Your father is goes to a barber every week.
True.
Your mom goes to the salon every week.
Yeah, we normally say things like hair. People will always wear clothes. People will always make their hair. People will always eat. People will always do their makeup. These are constant things that will always be done.
A good example is COVID. Now tell me, during COVID, among all the services after everybody was, the country was locked down and we were all indoors.
At home.
The only thing everybody went up in arms and to the point that the government had to open were the barber shops and salons.
Yes.
Because everybody, they stayed in the house and they realized it looks like Mama who's time that you have not shaven, you have not done your hair, you have not done your nails look pathetic, until they said no, we can't take it anymore. Please open the salons, please open the barber shops. And that's the day I realized
the importance.
So what I'm saying, the people who are interested, who are passionate with doing hair beauty, don't shy away.
Go for it.
Face your parent and tell them this is who I want to be, because it's paying. It pays. And if everybody went up in arms with the government telling them, please open the shops, it means
it is important.
It means they need us.
Yes.
And it means that we are there's something we are doing to the society which no one else can do but us.
Yes.
So it's
important.
a good thing, and we are very happy, and we thank Kenyans and we thank everybody for accepting also to consume our products, because if we don't have that consumption, when there is no demand, then you're out of business.
Yes.
So let me take this opportunity also to thank Kenyans for wanting to look beautiful and handsome, because of that, we find ourselves in business every time.
Yes. I'd like to read you some feedback. We have Jovial Dre. Wangari GIKUNDA, please ask this for me. Is Vera Beauty and Fashion a partner with the Vera College of Nakuru?
Yes and no. We started Vera Beauty and Fashion College in Nakuru as a franchise or a partnership, but we decided to put it separate. So Vera Nakuru is Vera Technical College, offering more courses than Vera Beauty. They offer plumbing, electricals and all that. So Vera Beauty and Fashion College is not Vera Technical.
Okay.
They are different. And like the person who has said, you notice that Vera Technical uniform is yellow in color, yellow and blue, and Vera Beauty is purple and
pink and purple, yes.
Yeah. So, but it used to be part of Vera Beauty, but as a partnership. So we have since now left the partnership to the
technical side.
The technical side, and then now it is called Vera Technical College Nakuru, and it's separate from Vera Beauty and Fashion College.
Okay.
Yes.
Is one more. Ambassador Alice, this is from Sandra Chepkemei. Ambassador Alice Kamunge has an inspiring message and interesting conversation, and I agree.
Oh,
thank you so much. As we wind up, maybe speak to your audience who would like to join. Talk to them. Talk to your young people.
Thank you. Let me talk to the young people who are out there, who are at home, wondering what to do. And I want to talk to everyone, from the young people who don't know what to do, the university graduates who are idle when you don't have classes, those people working and you have free time and one day you retire, and to those people who have never been to school and you are wondering what to do with yourself. The courses offered at Vera Beauty and Fashion College are courses which can help you in a big way, and not only the courses offered in technical colleges and what we offer at Vera Beauty and Fashion College can change your life in a big way, because like I said, we have short courses which can help you earn a living as a side hustle, regardless of who you are, regardless of what you are doing, including even those people who are stable, but you want to open your salon, you want to open your barber shop. Please go to a school, learn something, learn a skill, because when you are informed, you learn a better business than when you are not informed. And for those young people out there saying you don't have a job and you are idle, look around where you are. Look at the village where you are. Look at the customers who are out there. As you go out today, look at all those women around there. You tell me there's not a single woman who is not dressing. There's not a single woman who is not done nails. Maybe there are very few if you are deep into the village. And there's not a single woman who is not done their hair. So that is a job right there for you. So all you need to do is go to a training college where you can learn that skill, go back home and start earning your money a little at a time. And you'll be amazed what you can do with that career of hair, beauty, or fashion. Baking is something you can do right there in the village, because today we have jikos. The Njuakari people have become so innovative. We have jikos which are using charcoal.
Yeah.
We have jikos which are using firewood. We have jikos which you can use anything, so you can bake great cakes for weddings and birthdays right there. If you do event decoration and flower arranging, which village does not do events these days? So you can earn a living by doing an event decorator or event planner or makeup artist, nail technician. You can do masseuse, massaging people in hospitals, in places where people are sick. They need somebody to massage them. So even when you do that, you can be able to be a masseuse. You can do anything. You can do fashion. There are so many courses you can offer. And right now we are doing also videography and photography.
Wow.
Which we do that to help the people who are taking our courses be able to
be creative, take a photo and clean it and share it in your social media pages, so that you can attract clients from all over. We have in our school, we have students who are going even all the way to Mombasa to do services, because when you post something nice, you find yourself even being called in Eldoret or Meru or Kisumu to go and do a wedding. So I want to tell young people, the world has opened. Digital world has opened
in a big way. You don't need to be scared that you can't afford to open your own businesses because your business is right there on your smartphone. Take a course at Vera Beauty and Fashion College, train something, and it will help you to earn something, and even you'll be amazed that you can create a job out of that and even be an employer. Not only will you be employed, but you can be an employer. And I thank you so much for the ones who have come to train at Vera Beauty College. We have so many alumni. We have over 20,000 alumni out there earning a living, and I know they are earning a living and happy, and I'm very happy for them. I want to tell them that I pray for them every day that they'll become better people.
Wow, thank you so much, Madam Alice. It has been a pleasure to have you here. You can also follow Vera on all their social media platforms at Vera Beauty College, right? Yes. So thank you so much.
Yes. And our number, our telephone number for those ones who may want to know more about Vera Beauty and Fashion College is 0704 577 577. 0704 577 577. You can follow us. And also, before I finish, we have an event we call Equality Warriors. And Equality Warriors is for those people who are environmental lovers. If you are environmental lover and you're out there, come to Vera Beauty and Fashion College and join us and become our Equality ambassador.
Thank you so much, Madam Alice. Thank you very, very much. It's a privilege. I'm not going to lie. When I grow up, I want to be you. I want to look this good as years go by. I am not going to lie.
Thank you.
Thank you so much. I'm very motivated. I'm very, very motivated. Thank you so much for tuning in. We'll be coming back after this short break with our next guest, an artist, goes by the name Zala. So stay tuned. Do not touch that dial.
The best way to predict the future is to create it. Life is a preparation for the future, and the best preparation is to live as if there was none. Here, we believe the future belongs to those who dare to dream, the few who dare to be different. Welcome to Where I Belong, where smiles are cherished and memories created, and all our dreams come true. Perfection is the ultimate goal. Consistency is the roadmap. Letting our dreams be the wind beneath our wings, we elevate to success, satisfying our sense of achievement, value, and inherent joy in the act of learning. Influencing minds to think beyond imagination, creating realities that were once fantasies, making the world a better place for future generations. Welcome to Where I Belong.
You need to look for high quality friends.
I'm from Kingston, Jamaica, you know Portmore. That's my village.
Sanga kitini hapo ukinyea ukikatia mademo akipita.
Sina pesa saa hii, nimekuja kukopesa choo.
Naye akamwahidi Mwenyezi Mungu kwamba ikiwa mimi umenilaani, mimi umenifukuza, mimi umenitoa katika rehema yako, basi nitaenda katika hii dunia, lakini nami nihakikishe siingii motoni peke yangu, bali niwe na wafuasi. Lazima nitafute wafuasi, kwani huo moto nitakuwa nimeombewa mimi peke yangu.
Hello everyone, this is the new chapter of Let's Be Fit. I'll be host DiCaplo. I'm here to give you various workouts. I'll be having different trainers. We'll have Zumba classes, we'll have aerobics classes, we'll have box exercise, we'll have kata box, just name them. The show comes every Thursday from 6:30 a.m. to 7 a.m. Keep it locked, make sure we keep fit, and that's it from me to you. Let's be fit.
So from your mind conceive, then you shall achieve it. No make them stop you with their body. It's my master's will. I see the sun. Martin Luther, Malcolm X. So they want to change my identity. When I first met you, I already knew.
All Africa, we are a software company based out of Nairobi, Kenya, and we build customer-centric solutions that helps businesses communicate effectively with their customers. So the first solution that we offer is a VoIP solution. So the VoIP solution is basically a call center that allows you to push up to between 1,000 to 1,000,000 concurrent calls at a go. So that's either if people are calling you in or whether you're calling people out. The advantage that we've been able to also see with this is people can work remotely. So if, for example, you're in Nairobi and you're managing a team in Mombasa or in Kisumu, then you have full access.
Ukiwa na dukuduku la michezo, tunafungua sanduku la dukuduku kwa ufahamu zaidi. Kila danadana, mitimko, mifiatuko na harakati zote ugani, sisi ni wako mwandani. Kukurukakara zote nyanjani, haziwezi kuangaziwa zaidi ya micharazo michezoni. Mimi mwanaspoti wako matata Peter Pinches Mwaora, ndakuwa na jopo lenye maarifa sufufu, nikufahamishe na nikuburudishe wewe shabiki shakiki kwa uhakiki na kindakindaki.
Welcome back as per usual. Thank you so much for joining us. Thank you so much for tuning in and staying up until now. The conversations today have been pretty amazing, I must admit. Boom. Very nice. I have feedback from Ashley Asachi. Good morning, Nina. Halingam is watching loud and clear. Thank you so much for tuning in. I have Zala in studio with me. Very gorgeous.
Thank you.
How are you?
I'm fine, thank you.
How are you feeling this morning?
I'm good and happy.
And happy? Yeah. You actually look happy. Thank you so much for joining us.
Thank you.
Maybe take us through who is Zala.
Zala is a musician, a very happy soul. Yeah. And I'm really grateful to be here today. Yeah, I'm happy to be here, to be hosted here. Yeah.
It's a pleasure to have you here.
Thank you so
much.
much.
How has your musical journey been so far?
Yo, it's been a very, very difficult, adventurous journey. Haijakuwa easy. It's not easy, by the way, yeah. But yeah, I have tried my best. Mpaka nimefika hapa. Yeah.
Nice. Maybe tell us, who is Zala when she's not creating music?
Zala is I'm a swimming coach.
Yeah. Oh wow.
Yeah, I'm a lifeguard. I love swimming. I teach private students. When I don't do music, I go for swimming. I stay in the house. I do some movies, yeah.
Oh, nice. I also read that you're Ugandan, Kenyan.
Yeah. My dad comes from Uganda. He's an Italian and Ugandan. And then my mama is an Indian and a Kikuyu.
Oh, that's an interesting mix of culture.
And I was born in Uganda, in a place called Jinja. And then my mother came with me when I was 1 year old in Kenya. So I grew up in Kenya.
So technically you are a Kenyan.
Yeah, I can say that
you're a Kenyan through your life, but by birth and all that you are Italian, Ugandan, Kenyan, and Indian. That's a really interesting mix. Do you ever practice the cultures?
No, not really. Okay, culture. I really love Kenya, by the way. I have grown up with this Kenyan culture. So I'm used to Kenyan culture. But okay, once in a while I go to Uganda, to visit my, where I was
from
born.
your father's side.
From my father's side.
Yes.
Yeah.
Interesting. The musical journey. Let's get into your musical journey. Where did it start?
It started when I was in university. I was a kind of a liturgy prefect. That's where I started. I used to sing in choirs, I used to sing at home. Actually, my dad is the one who encouraged me to do music. He inspired me. But I used to be like very shy. I used to be very shy. But I had people around me who really did encourage me. That's when it started. My first single nilitoa in 2013, but nilikuwa this kind of so shy, sikuwa nataka kutoa hiyo music, okay, I think every musician wako na this thing in them, like kind of doubt wakistart, like how is my voice? You want everything to be perfect. I was like that. I wanted everything to be perfect, but in 2018, that's when I became really serious. I encouraged myself, of course. Nikasema, okay, let me do it now, So nika record my first single. Okay, there's this thing like a perfectionism that ilikuwa inanisumbua. So nilikuwa na record, ninachana nayo, like it's not perfect. So ikafika pahali, nilirecord nikachoka na music. Nikarudi Uganda. I started looking for producers there. That's when there's a producer called Skills. Ndio tukarecord nayo na yeye more and more nikakuja nikakaa nayo kidogo, like I was looking for a perfect director. That's when I got that. He's called Steve Mugo. Ndio nikapatana na yeye ndio akanifanya video. Releasing the music was hard for me because bado ilikuwa na hiyo doubt. But eventually I did it.
Wow. Let's get into more and more. You have a new song you released that roughly 2 weeks ago. Take us through that.
More and More is a love song.
What inspired it?
Actually, okay, what inspired it, I can say, is I listen to a lot of music. And my best friend actually, alikuja tukakaa chini, tukaanza kuandika More and More, like inspiration. Okay, I don't know how to say this. Tulikuwa tunasikia different music. That's when akakuja akasema, hey Zala, we want to sit down tuandike music, we record it. So thanks to him, whatever he is, thanks to him, he's the one who inspired me to write that song. It's a love song actually. It's just cool, simple love song.
Maybe take us through the process of where it started. You wrote the song and then all the way to production up until the release.
When it started in 2018.
The production of More and More.
Yes. It started in 2018. Tulienda Uganda by the tuka record. Tuka record the music. Tukakuja Kenya. I wanted to do the video. But now the problem was Corona ikahit. So we had to stop it from there. But then One More is an old song. Yeah, alafu so tukakaa hatukufanya the video because of corona, the lockdown. By then it gave me a lot of depression and stress because I was really ready to come to this music industry to do something different. Yeah, so tukarecord. Then after corona ilishaisha, that's when I looked for the director. After looking for the director, Njosa akafanya video. Yeah, so that's when I released the video.
How did you put yourself together after now you wanted to get into the industry with a bang, and then here is corona, the depression, you're not able to do things the way you had planned them? How were you able to overcome everything?
Through my very close friend. Yeah, they sat me down, wakani encourage, by the way, because it wasn't easy. It wasn't easy because remember, I have used a lot of money on the audio. Kwenda Uganda, the transport, the everything, wanahitaji pesa, production, because it's not cheap, okay? Yeah, but my friends, I had my friend and my dad and my mom, walini encourage, by the way. They really did encourage me. It was not easy, by the way. It wasn't easy. Alafu pia finances ilikuwa very low at that time. Yeah, but through my friends, walini encourage sana. Yeah.
Wow. What's the plan in the future? New singles, an EP, an album?
More coming. More coming. After More and More, I've got another one coming. Yeah, it's a hot one actually. It's really good. Yeah. So manze, you guys support me and mujitayarishe for the next one coming. Yeah,
you're shooting for us bangers for the holidays.
Mimi nakwambia,
which is very nice.
Yeah, tatu zinakuja, like zinafatana. Yeah, like zinafatana.
That's perfect timing. Yeah. You do your music currently now. You're doing your music from Uganda or from Kenya?
Both. Yeah, both. As long as the producer ananielewa. Hata Kenya, Kenya nitafanya nao kazi as long as the producer understands me na tunafanya kazi poa. Yeah, we're good to go because the videographer actually is a Kenyan. I just wanted to try something new. Yeah, something new. Na huyo producer alikuwa amenielewa in a big way, alikuwa amenielewa because yeye ndio amefanya the first, the second and the third. Yeah, so the videographer ndio nikatafuta Mkenya because he is really truly good. Yeah.
Nice. Moving forward, any collaborations we should expect?
Yeah. After my second release and my third. Yeah, expect something big. Yeah.
Who would you like to collaborate with in the Kenyan market?
In the Kenyan market, we have oh my God, Red Sun, and there's a man called Calligraph. Calligraph, they really inspire me. Yeah. Calligraph actually. He's really good.
He is really good.
Yeah. He is an international man. Red Sun, kuna Waire. Yeah.
Oh, those are names we barely see. That's really nice.
Yeah.
Because those are icons.
Yeah, because Kenya nafanya in the industry, ni kitu yenye tutasikizana na hao. Yeah. Yes.
Wow. Moving forward, who's your role model in the industry?
In Kenyan or in general?
That's upon you. You are the one who will decide.
Gosh, I have many. In international, I've got Nicki Minaj.
Wow.
Rihanna, Billie Eilish. Yeah, international. And when we come in Africa, we've got. Okay, to be very honest, I look up to Zari Boss Lady. Yeah, he's really hardworking. He's really okay. She's really good. She's really good. Yeah, she's really
her craft.
Yeah, she's understood her craft
and her audience as well.
Yeah.
Wow. As we wind up, where can we get you on social media? Where can we get your music?
You'll get my music in YouTube, Zala. Please like, share, and subscribe. Alafu my Instagram ni Zala Music. Please go and follow.
Subscribe. Right before we wind up, someone has sent an interesting question.
Yeah.
since now you have 4 cultures, as you are getting married, which culture should you follow? Or rather, which culture will you follow? It's completely out of context. But during dowry negotiations, do we go the Indian way, the Italian way, the Ugandan way, or the Kikuyu way?
Gosh, hakuna nini. Sitafollow any culture mwenye nitapata ni sawa.
But how will they come to your home?
Okay.
You've not thought about it?
I've never thought about it, but
at least we've given you food for thought. That was someone watching who was curious.
Yes.
So you can give us an acapella as we get into it.
Yeah.
It's all yours. Stage is all yours.
Yeah, thank you. Here?
I think it would be easier if you performed while sitting.
Okay, while sitting.
Yes, you want. All right. Right before we wait for the acapella, thank you so much for joining us. I have been your host, Anina Gikunda. This is Woman Crush Wednesday. Rise today. We'll see you tomorrow at 8:30 p.m. on Beyond Limits. KUTV Kenya on Facebook, KUTV Kenya on Instagram, and KUTV_Kenya on Twitter is the place to be. Send in your feedback, talk to us, send in your opinion. I will see you next week, same time, same place. All the way to Zala. The stage is all yours. You can camera.